COVID-19 pandemic has exposed the strengths and weaknesses of various health institutions across the globe. For effective and efficient services of healthcare workers, the first element to be provided with in this situation is the PPE, that is personal protective equipment. PPE is a form of waste that was specially designed for health workers to be prevented from contagious disease and to prevent the transmission as well. A well-protected health worker, especially a nurse, will discharge her duty unhindered. This is a first form, or this is a form of motivation, and it is the primary responsibility of health institution to provide PPE for the front liner. Hazards at workplaces is one of the major causes of death among health workers globally and in Nigeria, most especially among the nurses. Nurses have the full right to refuse to care for a patient if her health is in danger. There are fundamental rights of nurses. As the patient has his or her right, the nurses also have his or her own right as well. And if the life of a nurse is in danger during the service, it is our primary responsibility to ensure our safety or our security is maintained. The nursing profession was not meant to put the lives of practitioners in danger. Rather, they are trained to be saving people from death. Nurses are trained to maintain a safety technique, and that is, in a layman term, protective measures technique to prevent the transmission of these viruses, especially the COVID-19. Now, the question is, if a service was introduced to a nurse, does she has the right to reject such service? Especially, I'm talking about COVID-19, when there are no equipment. Of course, she has the full right to ensure that her life is safe. She should keep herself from danger. I would like to ask you questions. A farmer that goes to the farm without farming tools, what will be the outcome? A soldier that goes to the war without military equipment, what will be the outcome of such war? Nurses are very good in improvising. This is not only in Nigeria but across the globe. But is it wise enough to be engaged in improvisation at this stage, when there are so many things that is happening, especially with COVID-19? I think nurses should ensure that their life is safe, maintain their safety, ensure they are well secured, so that they can have the full capacity to discharge the care accordingly. Thank you.